Today I'm talking about non-surgical hair restoration, which is a pretty common topic in the field of hair restoration surgery and just hair replacement. I think there's a kind of a misconception. Non-surgical hair restoration, really in my mind, is more like hair loss prevention. Once a hair follicle has been gone for a certain period of time, it's not going to come back and you can't bring it back to life. There are a few things you can do, Propecia, finasteride, Rogaine minoxidil, or laser therapy to help reverse maybe recent hair loss or take thinning hairs and make them a little thicker. But really the only true way to restore hair is with surgical hair restoration. That's taking hair from an area where you have an excessive amount of hair and putting it into an area where you're deficient. Usually the back of the head is where we have the donor. We take it from here and we move it to another area in the head. So I think that there's a kind of a misconception with non-surgical hair restoration, and I think really it should be called hair loss prevention.